It is a procedure that is used to open a clogged artery. As many as 1 million Americans have stent procedure done each year. Dr. Cam Patterson is the chief of cardiology at UNC Chapel Hill. Dr. Patterson, thanks for joining me. So
it's my pleasure, Cameron.
What do you think? Here you have this, the former president leaving out today, walking. He went in talking on a cell phone and left out talking and ready to work. Is this pretty much how you would expect a patient to be able to be up and at 'em right after this procedure?
You bet it is. You know, this is actually a pretty simple and straightforward procedure. It's basically a tune-up for the president to keep his heart healthy, and he's going to be, back in Haiti in a week from now, I suspect.
Well, let me ask you, his doctors were saying that he complained of discomfort. They were careful not to say, strong chest pains of discomfort. There are, as I mentioned, a lot of people who have this procedure, and honestly, a lot of people may find themselves facing something like this in the future. What's your advice for others who have similar cases like the president?
Well, I think the important thing to keep in mind is that the president recognized the symptoms and caught the problem early before he had a severe heart attack. And that's really, I think, the important message to get out to people who are listening to this is we need to pay attention to subtle symptoms that may reflect serious problems that could lead to a heart attack if we don't intervene with a procedure like an angioplasty or heart surgery.
And for the 1 million other Americans, including now the former president, you have this surgery. What do you keep an eye on, let's say, in the next month? As you mentioned, he wants to go back to Haiti. For most people, it's just getting back to work.
Yeah, so, you have to get back to work. You have to go about your normal business. You have to pay attention to your cholesterol. He's going to be on some medicines that will keep clots from forming on the stents for a period of time. That's important. Following a good diet, keeping track of your blood pressure. Those are really the key things to focus on. It's really, the day-to-day care of his major heart issues.
Well, he is not alone. As I said, 1 million other Americans have the same procedure every year. Thank you very much, Dr. Patterson. We greatly appreciate your time.
My pleasure.
And I'm told we've got some live pictures in of the Olympic torch run. There you have it. You see people, and I love it, folks on the side of the street cheering on the torch runner. Don't know who this individual is. Hopefully we can find out. But earlier, a famous participant was California Governor Arnold Schwarzenegger. He